While parents are busy shopping for backpacks and school supplies, there is one essential item that shouldn't be overlooked, and it's a school physical.
UI Health is here with practical tips to help children start the school year healthy and ready to succeed. Dr. David Anyadike is here with more. Thanks for being with us.
Hey, afternoon.
Okay, school physicals. Do you remember the days?
Yes.
When we had to go for our school physicals?
I remember having to pee in a cup for the first time. That was interesting. Do they still do that, Doctor?
Yes, it's certainly is, yes.
That's part of it.
Now, why do parents need to be sure to remember this on their checklist?
It just because we're so busy as parents, there's always so much going on, and this is a great time. Well, we need to fill out the form, of course, but it's a great time just to look and make sure we're doing everything we need to keep our kids healthy. The preventive, health part that keeps our kids healthy, so we're not stuck later and taking a sick kid somewhere.
Yeah.
We always say you need to take a moment for your to take care of your health. You have to spend a moment to take care of your wellness, so you don't have to spend time taking care of your illness later.
Okay. So what are some of the things we're looking for in a physical? I feel like it's one of those things that you may even forget about till you go to register and it says, oh, this age needs this. So what are the things that they're looking for?
Well, making sure you're up to date on your shots, making sure you're getting your exam done, your hearing and vision, depending on where you're getting it done. Also checking for anemia. Actually, this year we have new guidelines that are looking into making sure our iron levels are better maintained. So we're going to make sure we're checking into all that stuff to make sure that everything's done well, but also other things too. So we're also making sure that the educational needs are being met. So things we need to do ahead of time, like things that need to be done for your individualized education plan or stuff to make sure that your kids are, their autism or any kind of learning needs are being addressed. Making sure that anything we can do, a hearing screen or getting to see a specialist, all that's being done. Even for us, we have a specialist that we refer people to who will advocate for the parents. So, because you don't know what you don't know. So if you're going to a school and trying to get resources for your child, how do you make sure you're getting the most for your child, the best education possible? And so there's actually an advocate who will connect with you and make sure you're getting that done.
Love it. It's a wonderful opportunity to slow down and check in, on everything from nutrition, sleep, mental health, other concerns, right?
Yes, all of that's so important.
Yeah. And you say, should you just check in directly with the child maybe about how they're feeling emotionally, mentally, about the support they may need?
Yeah, it can be a lot, especially with, for the whole family. School starts and it's a big change, a lot of transition. And so for the kids too, especially if they're starting a new school, high school, a new, elementary school, but definitely high school is a big transition. And so making sure you guys are checking in, taking a moment in the car, don't hit them right when they get in the car with all that. But after they've been sitting for a while, or, after you've got home and you're eating a little something, or at bedtime, if you guys are interacting, with the younger ones at bedtime, checking in, say how you're doing. Don't make a long, big speech out of it, but a nice brief check-in, see how they're doing. I often say a lot of parents are trying to figure out how to get more physical activity. So dancing and other stuff at the home, they do a little physical activity together, and at the end of that, you're saying, and you say, well, how are you doing? There's always a time to kind of get in there, and it's just best to, to bring it up, to get that connection going.
That is such great advice. And if people are watching right now saying, oh, shoot, I didn't yet do the physical, there's still time with UI Health, correct?
Yes, and actually we have, so UI, I work with Mile Square, UI Health. We have 12 different sites across the south and west side of Chicago. And we do take walk-in visits for school physicals. You can actually Google Mile Square back to school and actually find a list of all the times we're available. My site is at 79th and Halsted, and so we do have walk-ins from 8 a.m. to 7 p.m. for school physicals.
Beautiful, and all that information right there on the screen. Dr. David, thank you so much for being here. We really appreciate it.
Oh, no problem, my pleasure.
Yeah. All right. And no appointment needed, by the way, for any of those clinics. So thanks so much.
Yeah, scan the QR code on your screen if you want more information. And stay